Good day everyone and welcome back to my YouTube channel. If you are new here, I'm Miss Brain and I discuss everything health. In today's video, I'll be talking about PCOS, which is Polycystic Ovarian Syndrome. So this PCOS is characterized by the presence of irregular period and presence of cysts around the ovaries. That's the ovaries are now filled with fluid-like substance around it. Okay, so this condition can also be referred to as ovulatory factor infertility. So that leads us to the signs and symptoms of PCOS. But before then, you have to bear in mind that some people who actually suffer from this PCOS might not really exhibit any symptoms. Okay, but the symptoms as well can vary, ranging from irregular menstruation to no menstruation at all, or presence of hairs in areas where it's not commonly found in ladies, like the facial hairs, the chest hairs, and hairs around your umbilical area, that's in the abdomen. Then obesity, oily skin accompanied with acne, and the last but not the least is infertility. And you also have to bear it in mind that PCOS increases the chances of a lady developing type 2 diabetes and or cardiovascular disease. So I said and or in the sense that you can have just one or you can have the two disease conditions at the same time as a result of complication from the PCOS. And you're also at risk of developing endometrial cancer. But let's not go into that now, okay? So what are the possible causes of this disease condition? It is said to be unknown but genetically linked. How do you diagnose PCOS, or how do you come to the conclusion that a lady actually has PCOS? So this is not what you just sit at home and say, oh, I have PCOS, or I don't have PCOS. So for a diagnosis of PCOS to be made, there must be presence of two things out of the three things I'm going to talk about. Firstly is the clinical or the laboratory evidence, which includes the presence of hyperandrogenism. The hyper is high, androgenism, that's male hormones, male component. So if it's more in a lady, then it is something to actually look out for. This can include high level of male hormones like the testosterone and presence of facial hairs. Secondly is menstrual irregularities ranging from oligomenorrhea to amenorrhea and irregular menses. That's not having a particular pattern. You might have like 40-day cycle to not even having menses in the next 4 months, 5 months. Last but not least is ultrasound, which reveals polycystic ovaries. When you have 2 out of these 3, then that is when you get the conclusion of PCOS. So what are the possible investigations to be done as well? You have the hormonal assay to actually check your hormone levels, and that is when you come to the conclusion of if you have high testosterone level as well. Then ultrasound, which reveals what the ovary looks like. Then, and other tests can also be conducted to exclude the other causes of your hyperandrogenism. So let's say the reason why you have the high male hormones in your body. Example, if there's presence of congenital adrenal hyperplasia. So we need to know if there's something else going on. So what is the treatment regime for this? Please, I need to place a disclaimer. I'm not doing this video for treatment's sake or to tell you medications to actually take to treat your PCOS. You need to visit your doctors if you have any of those symptoms I mentioned, so you could be able to have tests done and check and reach a diagnosis of PCOS. Then the treatment is now left for your doctor to decide because it varies, okay? So the treatment is individualized in the sense that for a lady who wants to conceive, the treatment is different from a lady who just wants to like stabilize her menses and have a regular pattern, to someone who just maybe wants to lose weight because my PCOS is causing me to be excessively overweight. So there are two different things. So your doctor needs to decide this for you, but I just gave you headings on how the treatment normally goes. So for people who are normally overweight, exercise plans and dietary plans can be given, okay? Then the rest is left for your doctor to actually conclude. Then good news is I've seen and I've heard people saying, can I actually conceive with PCOS? Yes, you can conceive with PCOS, but time to track your periods. Even in those periods, you don't ovulate in every period. So this is what we call an anovulatory period. So you don't have any egg released in those periods. So you actually need to see a doctor who can actually help you prescribe some medications that will stimulate your ovulation if you're in the category that wants to give birth. Okay, so it's nothing to worry about. This brings us to the end of today's video. Thank you for sticking around. Please don't forget to click the subscribe button if you've not done that already.